I think there is a lack of awareness about health, and it is already difficult for citizens to have access to healthcare.
Montreal's Parc Extension neighborhood holds one of the lowest registration rates for family doctors at 61%, forcing residents to go to emergency rooms or find walk-in clinics that serve them. A challenge made harder as most of the families here are newly arrived to Canada. Some do not speak the language, and some are not properly informed on how to access health care.
It's very frustrating, and I'm smiling at the moment, but I feel a bit hopeless about this.
After an accident left her leg fractured, Mariam Haddad, a lawyer that works exclusively with refugees and asylum seekers in Parc-Ex, says the care she received in hospital was rushed.
They said that they couldn't do anything much about it because of the way the fracture was positioned, and then they said, okay, you can leave. I'm like, how do I leave? Do I need crutches? And they're like, oh yeah, we can give you some.
Haddad had a risk of a pulmonary embolism, something that was not caught after her first visit to the ER. Instead, by Nabila Kunda, a physiotherapist, alongside Jasvir Kaur, both in the field of primary care, both of whom working together to serve those in Parc-Ex. Haddad says the experience opened her eyes to how much harder it may have been for her if she was new to Canada.
I thought to myself, like, I speak the language. I was able to just ask for something, for some help. So I was given that, but I wonder, like, people that do not speak either of the languages, if they would be.
Kunda and Kaur say Quebec's French language reform, or Bill 96, has made accessing healthcare in Parc-Ex even harder, and combined with a lack of family doctors, it can lead to further health complications down the road.
By the time I see them, it's already too late. I cannot help them. There is medication. Medication is not sufficient enough, so they have to go to an orthopedist, or after to get an injection, cortisone shot or anything. So something even higher.
I think in an ideal world, people are seen quicker in ER, people have access to their family doctor or some kind of family doctor quicker. It works well. We all want to work. We all want to work together. I just provide that kind of foundation for us to do that.
All three women agree that Parc-Ex requires more attention and less red tape.
I think there's a lot of red tape that needs to go. And I think initially the prime system was made kind of equal distribution, but I think we're forgetting to distribute where the most concentrated people in Quebec are.
In Montreal, Felisha Adam, City News.